Hi, my name is Joanna Ramstow, and I'm a clinical social worker with counseling and psychological services at University of Michigan-Dearborn. And I'm here to talk to you about how you might identify whether or not a student is in distress. This is incredibly important given that we are in such a radical time of shifting and change in this remote learning environment. And faculty and staff need to have the tools to know whether or not a student is struggling and how to get them the help that they need. So a few things you might look out for. If a student is in some sort of distress, you might look out for big changes to personality or behavior, such as unusual behavior or comments, or somewhat erratic and emotional statements. You might also look out for big changes to school performance, grades, and participation levels. For example, if someone starts the term as a real active participant and is doing well, but then starts slipping, starts requesting extra accommodations on a frequent basis, and starts maybe even having excessive absences or lack of engagement, this might indicate the student is struggling. Simply ask them, check in with them, how they're doing, and be willing to listen and be non-judgmental. Avoid giving advice or trying to make the student feel okay, as this can come across as invalidating. And always remember to direct the student to campus resources such as the START Academic Advising Office, student organizations, or counseling and psychological services or disability services. If a student is in severe distress, they might exhibit more concerning behaviors, such as hostile and aggressive statements, referring to self-harm or suicide, either verbally or in written assignment, or threatening to harm others in some way. If any of these are in the case, the student is probably in need of immediate help. So the biggest priority is to refer the student to the appropriate resources and interventions. Do not feel that you are responsible to step in as a professional. Rather, refer that student and make sure they get the help that they need. Calling campus police, CAPS, or making a care report, which you can find on the emergency services webpage on the U of M-Dearborn website. Also, make sure to document any interactions that you've had so that you can make that in the care report and have it for your own records. To know more about identifying a student in distress and other helpful resources for faculty to help the mental health of our students, please check out the faculty toolkit on the CAPS website, and feel free to reach out to us for consultation or other advice. Thanks for tuning in, and I wish you a great start to this semester.